Welcome, Nuria. Thank you so much.
Thank you very much. Well, thank you all of you for coming and being here. First of all, I want to thank the organization and Kevin for everything is great as always. Last year, last edition, it was indeed a very special edition for me. Many of you probably will remember that I talk about cancer and pain during the cancer and how to support it. And I agreed that conference more than a year before it happened. And the last case I presented in that conference was my father, who passed away just 15 days before that conference. So it was hard for me that day, but today is a very happy day, and I am very happy to be with you. And I hope that you not only enjoy what we are talking about and the examples I am going to tell you and the ideas, but above all, I would like you to enjoy being healthcare professionals. This is very tough. Really, most of us, we work alone. It is not easy to deal with hard cases, and we go home and we think, and maybe we have nightmares and we do not what to do with some things, or we feel depressed even, or we feel scary about some cases that we have. But these conferences are for not only for gather us, but only for being proud of what we are. In a simple way, we are just tools for our patients. We have the knowledge, we have the tools, but we do not cure anyone. It is themselves that cure themselves. And today we are going to talk about endometriosis. I have done this in the old-fashioned way. I have bring my papers because I talk a lot and we have a limited time, and I just pointed out some ideas that I will like to tell you beside what is on the slides. On the other hand, you have my website, my email, you can contact me if I can help you. And also I would like that you take notes of the questions, but because usually the answer is in the next slide, and at the end we can have all the questions that you need, okay? So again, thank you for being here. Endometriosis is a very important condition, and there are another related conditions with endometriosis that we can treat with acupuncture and TCM. The very specific thing is that we in Spain, we do not make a difference between acupuncture and TCM. We talk about TCM as general, and acupuncture is a part of it, herbal therapy is a part of it, twin is a part of it, but we do not do this difference, but I know you do, so I wrote it like that. On the other hand, I love that the name of the conference is Gate of Life, because endometriosis is also related to fertility. So this is the gate of life too. So first of all, I have received, my mobile is off, I have received a lot of messages in WhatsApp from my patients and ex-patients, and encouraging me for the conference. And what is endometriosis? We are going to talk about endometriosis as a general condition, not as a condition related with chronic fatigue syndrome. Those who knows about my work, maybe you know that I was pioneer in working with chronic fatigue syndrome. Indeed, in 2002, I presented my work at Westminster University in London, and I talk about chronic fatigue syndrome, and I talk that chronic fatigue syndrome can evolve with to several conditions. I'm sorry for the mistakes I make in English. can evolve for to several conditions. One of them, endometriosis. If endometriosis is in the middle of a chronic fatigue syndrome, the treatment is a little bit different and a little bit more difficult. But we are going to talk about endometriosis, like, let's say, isolated, okay? Not with chronic fatigue syndrome. So you have in the slides, you have the most important data about the what I am going to talk about to you. And endometriosis is a condition in which endometrial tissue, it is the lining cells of inside the uterus, grows in another areas of the body. Of course, also in ovaries or tubes or uterus. But one of the main characteristics is that this tissue, this endometrial tissue, can grow in other areas of the body. Statistics are not very well updated, but now it is said that 10% of the women can have or can develop endometriosis. It means 1 in 10 women. It's too much. Almost 50% of the women with problems of fertility are related to an endometriosis that is discovered because they suddenly they want to be a mother, they can't, they make the exams, and they have an endometriosis. In a statistic in 2014, it was the latest I could find. It was said in the Health World Organization, it was said that 180 million women in the world have endometriosis. What is a lot? I do not have the data after 2014, but it means that it is a lot. So why or when do we suspect that this is there is an endometriosis? When can we suspect an endometriosis is the problem for a human? There are some specific symptoms and manifestations, and we in Chinese medicines, we made very quite important difference between sign and symptoms. So we talk about manifestation as a whole. Maybe the main manifestation or symptom is pain related to menstruation, but you can say dysmenorrhea also, or another conditions, another pelvic conditions can be related to endometriosis. But also an irregular bleeding. The bleeding related to menstruation is quite an important factor, and it should be regular. But irregular bleeding, we are going to speak about this more wider later. And also a manifestation of infertility. Of course, what happened? In society, it happens that we women have decided to be mother later than we were before. So that is why also those infertility cases or those endometrioma case, endometriosis cases are discovered later. Because suddenly when you are in your 30s and even in your 40s, you decided to be a mother, and endometriosis is discovered. Rarely, there is no pain. In my whole career, I only have one exception. She's alive, a woman, very, very thin. When you will understand why I say very, very thin, that has apparently no problem with the menstruation, but once she decided to be a mother, she couldn't. She underwent an assisted fertility treatment, of course with hormonal treatment, and he developed an endometriosis. He did it was a failure. He tried a second time, and then she developed an over hormonal stimulation. She was almost dead because of that. And this endometriosis was almost in the intestine, in the ovaries, in the bladder, all over. She was almost died. She got a surgery, and she still wanted to be a mother. She had tubes removed and all that. So in the end, she came to me, and I explained to her, if you are going to go through another fertility support treatment, we have to work in order to try to avoid the secondary effects of such a heavy and impressive hormonal treatment. And we have to protect you against the development again of the endometriosis, what started. Happily, she is a mother now. As she said, she was very practical. She is the manager of the security system in a very high and important company, a multinational company. So she's very thin. She works in security. She has to take the control of a lot of things. So she lives almost like a man. Take this into account. And finally, she has to decide to be a mother with a donor egg, and also with a sperma donor. So she, being very practical, she said, okay, I have a designed baby for me. Well, one needs to find that positive in the worst situation. So this is an extremely rare exception. Usually pain is one of the things that make us think that probably endometriosis is happening. But in women older than 30 years, infertility almost always suggests that endometriosis is happening. But we decided to be mother later, but we are healthier than some decades ago. So there is like a rare combination there. There are another common manifestations here. Pain. Pain, of course, is one of the main one, but also difficulties or pain or discomfort during sex or intercourse. This is an aspect that is very difficult to talk about. Also, depending on cultures, religions, there are many women that will not tell us about this. For example, in Spain, maybe this is the first thing that a woman will tell you. But there are some other countries that where I teach that I know this is something we cannot talk about. But if you make the question very carefully, you will have an answer. And it's very important because sex is a very important part of our life. And if there is not a real satisfaction or there is not a really happy life in that area, this is another factor to create a problem to a woman. Okay, so be careful when asking about that. Also, we can listen many things that maybe can be in contrast to our ideas, but we have to respect that. Also, there is a specific symptom related to intestinal function that is painful defecation and constipation. It doesn't mean that endometriosis is inside large intestine, but it can mean that there are some masses that make large intestine function difficult and painful. So we have another problem added to this condition. Another kind of pain we can have is lower back pain. If it is not enough having pelvic pain during your menses or with ovulation and in the second phase of the period, or also lower back pain that also can be reflected to belly and lower belly. So we have pain all over. One of the most interesting things is that there is not a direct relationship between the size of these endometriosis masses and the pain. If you make a scale of pain from 1 to 10, there is not a relationship. A mass can be so big, but maybe it is in a place where there is no such a pain that you will maybe you will expect. Another, there is a myth about endometriosis, and it is that, well, there is a myth about all female conditions. When I was young, grandmothers and grandmothers used to tell us, oh, you have a headache, don't worry, when you have a baby, it will be gone. Oh, you have pain here, or you are depressed, or what happened? Don't worry, when you have a baby, everything will go gone. And no, you have migraines, and you have migraines after you have a baby, and you have a headache, and you have the headache the same when you have the baby. So this is not true that everything is solved with a baby. So even endometriosis, it happens that there are many women that develop endometriosis after being mother and for the first time. Of course, if they have endometriosis before, it is very likely that they develop again endometriosis. But there are some women who already have children and develop endometriosis for the first time. In one hand, when that happened, I want to lose my pages. When that happened, we have to look for the causes very, very carefully, and to ask for hormonal treatment, not only for fertility, but for any kind of hormonal treatment, as we are going to know. For example, is she or has she been using contraception hormonal treatment? Because so often the pill is one of the main causes of endometriosis. There are another causes as we see. Well, this is like a summary, and I told you this is a very important thing, that this endometrial tissue travels and links in another places. So endometriosis has a very important problem related with its extrauterine localization. It's very important, the location. Ovaries, of course, fallopian tubes, of course, pelvic ligaments, it's very painful. Vagina, also very painful. Colon, very painful. Rectum, I cannot tell you about that, but this is not only very painful, but this is really a problem because this is an obstacle. And constipation is a minor word for that. This is real, a very severe and very specific condition, colon, rectum, and also urinary tract. All the organs are almost together. There is not a still wall between the vagina, the rectum, and the urinary tract. It all is connected. Okay. And one of the worst places is lungs, but there is the possibility that endometriosis finish in lungs. What is the problem? That endometrial cell get fixed in abnormal places, not in the uterus. They get fixed in abnormal places without detaching them from this tissue. And these cells, because they are endometrial cells, they answer, they act to hormonal changes as if they were in the endometrial, in the uterus. So what does it mean? There is a response to hormonal impregnation, to the changes of estrogens and progesterone. And the main problem is that every cycle they grow, and they grow, and they grow, and they bleed. And they bleed where they are. And this bleeding provoke inflammation, provoke inner clots, and other problems we will say. This, about bleeding. Bleeding, if we have an accident, if we have something broken, we can have a clot in an arm or in a leg or wherever. But this clot will be reabsorbed by the body. But what happens with endometriosis is that the cell and the tissue will grow, and it will be stronger and bigger every cycle, because there is no means in the lung. There is no way out. These cells are growing and growing and growing each month, each cycle, like a plant we are sowing. So the blood, it is not only blood that is kept in this place, but also some waste and tissues and cells. And this provoke a tremendous inflammation that triggers a lot of process related with endocrine and immune and nervous system. But it knows that there is something bleeding each month in some part of the body. And also, this inflammatory and this bleeding is partly responsible for the adherence, the scar tissue, and for the pain. If we use, or if anti-inflammatory drugs are recommended, what's happening? We are just shutting down the pain. We are saying, oh, nothing is happening because I feel no pain. But this is not true. The base exists. We are just covering the real problem. But the underlying problem, it does not disappear. Next month, next cycle, it will be the same and worse. Here you have a picture where you have the main places where endometriosis and these cells can be linked in colon, vagina, bladder, intestine, and also over there in the lungs. When we have endometriosis, we have some masses that we have to think that they are a physical thing. So we have at least two problems. One is a biochemical problem, a biochemical impediment, because there are some changes in our body that provokes a lot of changes. And there is also a physical obstacle. There is a mass there. Imagine that the endometriosis is inside the tubes or around the ovaries. The ovaries are feeling a lot of pressure. Ovulation cannot happen. The tubes are obstructed. So fertility cannot happen. Okay? So according to authors, there are 3 or 4 severity levels to be considered, depending on where the masses are, depending on the pain, depending on not only the location, but also how the masses are, how big are they. But talking about the size of the masses, when they are very big, we talk about endometriomas. This word is a little bit scary, but endometriosis is a benign illness. It is not a malignant illness, okay? That's also very important because usually women, when they read these word endometriomas, they get confused and they think that something very, very awful is happening. It's awful, but fortunately it is not malignant. Okay. And another very important thing is that they can be we can find combined the uterine, I mean ovaries and top, the genital location with the extragynecological locations. When a woman is diagnosed of endometriosis, the next question is, do I get the surgery or not? It seems that we have to do with the that's the yes, no, yes, no. There are many women that do not know what to do, and the doubts are really easy to understand. First of all, endometriosis is not so easy to be diagnosed. Sometimes there are misdiagnoses. They talk about some kind of masses, but it is not known if it is myomas because there can be myomas at the same time. Sometimes they speak, I mean in the medical reports, they speak about cyst, so you don't know if it is ovarian cyst, but ovarian cyst like cheese masses or endometriosis. What does it mean? It is a little bit tricky, but in the end, a surgery is a surgery. You have to go to a surgery with an anesthesia, and all surgeries are risky. And maybe when a woman wake up, she finds out she has no ovaries or no tubes, and no one asked it because she was asleep. And even though she signed the papers, perhaps she didn't want what unfortunately happened then. Well, that's why key organs to hormonal function could be removed if needed, of course, but another problems will come later. And another very important thing is experience shows that endometriosis for sure will appear again. It may and can reproduce, and the problem will start again. Of course, there are some times, unfortunately, we in Chinese medicine, we are not always the first option. We are the second or the third, or when, well, I want a miracle and I come to you. So what happened is that probably the woman has already gone on through a surgery, and we find a second or a third endometriosis process, what makes things more difficult to us. Sometimes, I don't know if you are believers or not, but sometimes I tell my patients, okay, maybe I can dress myself like in the fairy tales and tell you, okay, ask me three wishes, because the situation is very difficult. I cannot relieve that like that. Of course I want it. But for us as healthcare professionals and also for patients, it's very important to understand what is happening. So I think it's a key if we can explain to them with very simple words what is happening. My records are full of drawers in order to explain women what is happening. I want them to understand what is happening, because I really think that our mind is very powerful, and we can help with our mind to relieve not only the pain but also the situation if we understand what is happening. So I have found a lot of women, young women in all ages, not only young women. Even I have found many of my students are physiotherapists, and I have found these students, these women, female students, that they don't know or they have forgot about how the cycle, the female cycle works. So I teach them how the female cycle works. And as today all of us have an smartphone, I download to them an app in order to follow the cycle. And I teach them which is the first day of the cycle. Which is the first day of the cycle?
You start bleeding.
The day bleeding starts. And many women do not know that. So many years ago I did that on a paper and they make copies to that. But now we have a lot of apps in our smartphone, many for free. So we can set, and I also tell them, how long is your cycle? I don't know. When a cycle ends? When does the cycle end?
Day before your period starts.
The previous day to the first bleeding day. So imagine we are September 1 and this is the first day of bleeding. So this is the day 1 in the cycle. So it means August 31 was the last day. So if you have a record in your calendar or something like that, you can add this data to the app, and so the app can tell you your cycles are 26 or 25 or 28 or 29 days. You know that between 26 and 30 is fine. The most important thing is regularity. If a woman knows when she can expect menstruation, it is fine. If one month is like 25 and another like 32, we have a problem. Irregularity is a big problem. It is more difficult to treat. So when they are back, I look with them the app, and we can see, and also in their apps where you can add symptoms, and so you can have plenty record with symptoms about how they are every day. So talking about surgery, here I have a case of one of my patients many years ago. It really shocked me because she was a young woman. She was a veterinarian and working in a place where they took care of animals that have been abandoned. She had a very good heart, but she was always angry. Indeed, when she came to the clinic, she was very angry, and I told her, I do not have the responsibility for your work or for your disease. I want to help you, but if you are angry, I do not want to receive that. We have to set our limits also. So she told me, I have been given 3 months. If I am not pregnant in 3 months, I will go through a surgery and I will be empty. I hate that word. When our grandmothers, and still there are many women, when you have your ovaries and uterus removed, they have been empty. Now I am empty. Empty of what? You are still a woman. But I don't like this word. And I tell them, do not say that word. You are a woman. Still you are a woman. Well, she told me that she only had 3 months to be pregnant. But because of a very severe endometriosis and also a retrograde menstruation, we are going to talk about this, each month she has less and less and less flow because she had a retrograde menstruation. It means menstruation didn't flow outwards but inwards. So in second, third month as much. Fourth month, she was completely stopped, and all the blood will be inside, and this can be a sepsis, and this can be a factor for dying. So this is very difficult. Well, we started working, but I still remember how angry she was. And I tried to, of course I work a lot, her liver, and I tried to explain to her, I hate when you come, and I hate when you come that I do not take anyone after you, because I am also angry. And I do not want the next person to feel I am angry. So when I told that to her, she was like surprised. Yes, you do that. Yes, I can stand for this. So she was a very special woman that she is a mother of two today. The eldest was born in 1997, but I knew that she has a boy. I prepared a treatment, and she came to acupuncture, and today suddenly she decided not to come anymore. But I told her, at least take the herbs and take the supplements, and please relax, and and all that. And I knew because a friend of her told me, and because I find her in the pediatrician with the boy, and say, oh, you didn't tell me anything. But in the end, she was very angry. Still, she was very angry. And now she is a mother of two, what is good. And I was so happy about this case, because it is very hard also for a healthcare practitioner to work with this 3 months program. You have like something telling 3 months, 3 months, 3 months. Each evening I was thinking about her. And here you have another very interesting story. She was 43 when she came. She teaches economics at a public university in Spain, and she had endometriosis, and she had all endometriosis removed with surgery. But after 2 years, the situation was almost the same, and she was older. It was 41. Now she was 43. What she told me was that she didn't want to be a mother again, but she was really in a very painful situation. She said, each menstruation is like hell. I'm very depressed. Indeed, she was on antidepressant treatment with paroxetine. And she was so depressed and so painful almost every day of the cycle that she has to quit the job, what is very difficult if you work in a public university. But she has to quit, and really there was a situation in which she told me, I do not like my job, I do not like teaching, I hate the students. And I say, why do you teach? Have you thought about doing another thing? Well, in the end, we started the program, and after 6 months of treatment, she has very large endocytes. After 6 months of treatment, endocytes stop growing. At this point, I would like to share with you my experience on how the endometrial masses progress during the treatment. They are not going to be smaller suddenly. No, it will not be like that. My experience is that myomas, all the masses related to blood stasis, there is a point when it seems that they are larger, but they are softer. So the immune system can work inside them. And then they start being smaller. It's very important to know that, because if ecography is done in this precise moment when the mass is beginning to be softer and suddenly like a sponge. When you have the sponge in the bath, if it is dry, it is small. When you put water, it is bigger but softer, and you can put the foam, and you can put everything inside. So this is something I told them with very simple examples. I told them the mass, it seems that it's growing, but it is not. It is getting softer, and it will be smaller after that. Well, the ongoing situation, evolution was positive. She got clearly a relief of the symptoms and the situation. She could go back to work even though she didn't like her work, but she liked the salary she had at the end of the month, and she could stop anti-anxiety medication, because you know that the anti-anxiety drugs have a lot of secondary effects, above all for someone who is thinking a lot. So she's fine. I know that she is fine now. So how do we know how endometriosis is evolving? We have to assess the progress. Okay, certain variables, we have to consider certain variables. The hormonal impregnation, it means the changes in estrogen and progesterone is really a problem. This point is very important. The moment where the ecography is done, it's very important. Try to select always the same moment of the cycle, not the same day. The same moment, not the same day in the calendar, but the same day in the cycle. And if possible, what do you think, before or after menses? No, before they will be larger, after menses, where and estrogens and progesterone are lower. Try to choose this moment if possible, because you can compare the results. The exams, when they are not correctly arranged, may provide us comparisons that are difficult and even not true. Well, so try to get the test done in similar moments of the cycle, very important. Try to have some control charts in paper or an app or something. It doesn't matter. But do not forget that you have a patient with a woman with endometriosis and alive. As in every disease, not everything is only the disease. There is a woman, there is a work, maybe there is a partner or a company, or there is weather changes, there are the news that are terrible sometimes. There are other factors affecting this woman, okay? So watch the changes and results and try to put everything in perspective in order to achieve better results. Well, this is another example. This is very interesting. Also a very interesting example. This is a woman I help many women. I have many patients with fertility problems, but I receive many women from other countries that come to Spain for the fertility treatment with egg donors and all that, because of the laws are different there, and I support many women there. And she told me that what is very interesting. I have found my perfect partner, so I want to be a mother. I have endometriosis, and now I am more than 45. Well, really, it is not a very easy age to be a mother. I am told that surgery will not result for sure, and recovery time has to be considered. So she wants to be a mother, she has endometriosis, she suffered a surgery, and then a recovery time. So what to do? A lot of scholars to make. So finally he decided about a transfer treatment with her own eggs, And she decided to make a treatment to have some eggs removed and freeze them until the moment is correct. And we work on endometriosis, and everything was fine. But this is, I put this example because it is not very easy to a woman to accept like 2 surgeries. For having your own eggs frozen, you have to have a hormonal treatment that will maybe be bad for endometriosis, then you have the surgery, then you have the recovery. So we think that we made the treatment thinking that the recovery time is as short as possible, and also trying to control all those factors that make endometriosis, or to avoid endometriosis to appear again. And everything was fine. 3 months later, she had a positive hormonal change, and she got 4 follicles, 4 fit to implantation, not the 4 at the same time. She got 4 frozen. One of them she was implanted, and now she's a mother. So I tell to you this example because so often endometriosis is more complicated than it seems, but because of another factors around of being a mother. So now, and very briefly, let's do a brief review about hormonal biochemistry in women. This is a photo of the moon phases. I really love it. And for those of you who do not remember about that, there are more than one cycle. We speak about cycle, and we speak about a menstrual cycle, but there are more cycles. Menstrual cycle is this one that starts, the day 1 is when bleeding starts. But ovarian cycle is another cycle, how ovaries are working, answering to the hormones. We are going to, I have a chart later. And there is another cycle, the endometrial cycle. Just to point out the difficulty of our female body, here is the menstruation, okay? So when in the endometrium a cycle is ending because no pregnancy has been achieved, it doesn't matter why, there is no pregnancy. So the endometrial, the flourish, and we have our mens. So a cycle ends. But in the ovaries, along with hypothalamus and hypophysis, a new cycle starts. So this time, what also means this time, the end of the menstrual cycle, is a very, very complex situation, very rare days where things are ending in the endometrium and things are starting in the ovaries or in the brain. By the way, we are going to live tonight the autumn equinox, so congratulations. We have only 2 days in our calendar where yin and yang are balances, and we are in one of these. Well, both hypothalamus, hypophysis, what they do. Hypothalamus creates gonadotropin releasing hormone, and it goes to hypophysis, and hypophysis triggers the liberation of LH and FAH, the lutein hormone and follicular stimulating hormone. So hypophysis answers to hypothalamus, the cygnus, and hypophysis creates FSH and LH. FSH stimulates the development and maturation of follicles inside the ovary. And LH, this happens mainly, but not only, okay? Mainly, FSH and LH we have in both half of the cycle. FSH acts mainly but not only in the first part of the cycle. NLH works mainly but not only in the second part of the cycle. LH on her side, he provokes the egg expulsion from the follicle, it is the ovulation, and transform the follicle that now is empty into the corpus luteum. Corpus luteum. Luteum comes from Latin luteum, that means yellow. So the corpus luteum. So you will remember that it is the peak of LH. It is a strong change in the amount of LH in our blood that provokes ovulation. If this peak, this is like hypophysis shouting to the ovaries, hey, you have to ovulate, but in a chemical way. But if the shout is not enough, ovaries, they say, I heard nothing, I am not going to ovulate. Okay. So estrogens and progesterone, of course you know that. In one side, estrogen provokes that in the endometrium, the cells multiply. So it is like mostly a Jan function. Okay? And on the other hand, progesterone provokes that the cells that have been created under the effect of estrogens store food for the embryo to come. So this is mainly a gene function. Also, progesterone prepares the mammary glands for breastfeeding. If there is not a pregnancy, all is lost. The work of 25 days is lost. We women are working every day. Well, let's talk about Chinese components in that sense, and I know that sure we are going to arrive to the break. Elements and spheres we have to take into account. Of course, liver and good sphere as a relational element. Blood is transferred to uterus for the possibility of a pregnancy, or if not, the menstruation will take place. Liver helps that to chi, and it will flow smoothly with a proper rhythm, and the cycles, the 3 cycles will be perfect, and all will be in the perfect moment, and like a treasure. And there is no delay and no mass formation and no tissue accumulation, and the menses flows downwards, and it's not kept in place. Everything flows in the right direction with a good liver and good sphere. But there are also another organs and spheres we have to take into account. Spleen and earth, of course. We cannot have enough blood if our spleen and earth is not working correctly. Santiago, in order to connect the whole organs and connect an upper, middle, and lower yaw, Chunmai and Renmai, heart and kidneys, of course, and related to the sense, to yin. This is a chart in which I want to show you where, regarding the severity of the masses, endometriosis is. I worked for many years with female conditions. Indeed, I did not look for that, but you know, in life things just happen. In this April, in 1998, I got my first paper published when I was still studying my first career. It was pharmacy, and I was offered some themes in order to investigate, to make a research. And to be honest, I do not know why, because I was 23, And I decided and I chose female infertility. And in one hand, remember, internet didn't exist. And I got that article, I got this published 30 years ago. And I think that really these articles gave me a perspective that put me inside. I wanted to understand all this mess about chemical hormones and immune system and everything working at the same time, and we are alive and we are not crazy, so everything was fine. So what about the possibility of different kind of masses? In Chinese medicines, we can talk about qi masses and blood masses. For example, we can talk about qi masses. Qi masses are usually easy to deal with. They are easy to treat. Ovarian cyst or mammary cyst, they are easy to treat. They can be swelling and they can be painful, but it is easy to treat. Of course, it's much more easy. It's easy to treat ovarian cyst syndrome that a myoma, of course, than an endometriosis. If we have qi and blood stasis, the next step will be myomas. It doesn't mean that polyovarian cyst syndrome will convert or will transform in myomas. It doesn't mean that. They are different situations and they can be, unfortunately, at the same time. And endometriosis and oncological masses, they are qi and blood masses, but they are more severe than myomas. They are more severe. This one because they bleed in any other place, and this one, you know why. The difference is that they are benign, and these are not benign. They are malignant. Okay. Well, and here you have a chart. We will use this later too. And this is about the main syndromes we can find related to endometriosis: excessive yawn, toxic fire, gene deficiency, cold, blood stasis, of course, and qi stasis. And also some aspect we have to take into account of, also we have been talking about this already, mental aspect, the beliefs, those about religion, social, how we see ourselves, how the world see ourselves, what do we think of the world and all that, and also what we live and what is happening, emotional aspects, and how we react to problems in any field. But the problem can be the same for all of us, but we are going to react in different way depending on our beliefs, and our emotional answer will be different. And also we have to consider the physical. Of course, we are talking about physical considerations, but do not forget about mental and emotional levels when you are treating with endometriosis. So, regarding the imbalance in the hormones, what we see in endometriosis, it is like there is a real, an actual estrogen excess. It means you make a blood test and there are really more estrogens than it should be, or there is a relative excess of estrogens compared to progesterone. Usually in Western medicine, it is related to a bad or a poor liver function, because it is liver that has to deal with estrogens, had a medium life, and then they are destroyed. And that it matched with Chinese medicine. When liver good is not working properly, estrogens is almost like they live forever. So it seems, functionally, it seems that they are more estrogens, but really they are not. There are not more. That they are functioning for longer. They are the same, but living longer. So Also, a very important thing is that endometriosis can be associated to an ovulation. There is no ovulation, and it can be another more cause for infertility. Of course, we said that even ovulation occurs. If there is a physical impediment, there will be not pregnancy. Okay, but this situation is similar, for example, to the one we can find in ovarian cyst, in ovarian cyst, and the whole syndrome. So, until here, so far, and then I think we make a summary and we make a break. Okay. We have to remember regarding endometriosis, endometrial cells react to hormonal impregnation, so they react to estrogens and progesterone. Associated infertility to endometriosis can be related to physical obstacle and also to hormonal dysfunction, or both. The extrauterine pressure is very important. If the masses are out, the uterus are out, the ovaries, there is an extra pressure, like a physical impediment. And so implantation and the embryo, implantation will be difficult, and the embryo or the fetus will have difficulties to grow because there is no place. And remember that there is no place, there is a lot of pressure. And another thing to take into account are the adherences or the scar tissue that is also very painful and does not allow the ligaments, the uterus to move, because during the cycle, uterus move, the fallopian tubes also move, but if there are adherences or scar tissue, they cannot move. Many authors say that endometriosis has an unknown cause. Okay, I say it like that. Retrograde menstruation is when menstruation does not flow outwards, but they do not flow, it doesn't flow, or they flow inwards. It is kept inside. It can be related to the position of the uterus. If the uterus is very backwards, men cannot go outwards, but it can be also related to the position of the masses, in which blood cannot go out, or there is inflammation and blood cannot go out. Mainly the diagnosis will be between 25 and 35, but this age is now older because of nowadays how society is. Remember, usually it is related to pain, discomfort, infertility. It is very rare that a woman with endometriosis that does not have pain, but please, if she tells you, I do not have pain, believe her. It can happen. And also, endometriosis mimic another conditions, so that's why it's very difficult to diagnose it. There can be also a genetic aspect. So often, your mother or aunt, your family mother can be or can have also endometriosis, but some decades ago endometriosis was not diagnosed. Believe that. They have painful and terrible menstruations, and they couldn't get pregnant, but they didn't know they had endometriosis. And also, it's very important for me that liver is in the middle of all that, and I call that the liver link, in which this is a theory I have developed, and soon will be published in English and in Spanish complete. There are some articles in the internet if you write the liver link to explain so that. So I think I am on time. Where is my assistant? I'm on time, no? So we make a break if you want. Have something, not too much, because we have to be awake. Thank you.
What time do we start back again?
Half an hour? Is it half an hour?